Okay, hello, and welcome to another episode of Hair Fix Friday. We're in New York today, and we're doing something very interesting. Last week, we had an excellent patient, my wife Edith, and her eyebrows. She was very calm. Women tend to be much better patients than men in general. I don't know if I can say that without having human resources give me a call, but just seems to be the case. Anyways, we're doing something very interesting today. I've got to introduce you to my friend and doctor and colleague, someone I've known for many years, one of, if not New York's top plastic breast surgeon, Dr. Adam Schaffner. And look at him. Look how handsome he is. He's in his own chair in his own office. And it's so funny because he doesn't need anything done. He's great, but he's gonna get a little hair today. And I just wanna hear from him what that feels like, because it's not so easy to be a patient, especially when you're a doctor. I don't like going to the dentist. I don't like having anything done. I squeam when my kids have stuff done. And I'll be very professional with Dr. Schaffner, but you're gonna have a little hair. How do you feel about that?
Well, I'm president of the Chicken Little Club. And so, needless to say, I think it's much better to give than to receive. But unfortunately, despite best efforts, as the world can see, it's been a little light in the top. No matter what we do with aging, we can go ahead and work out, we can eat right, diet and exercise, sleep, but certain things are genetic, and certain things with aging you can't completely fight, and that's where someone with your expertise comes in.
Unbelievable. The guy's a total mensch. My friend, look at him, the president of Chicken Little Club. So we'll get started in a little bit and we'll circle right back at you. Last week with my wife, it was eyebrows and Jeffrey Dahmer on the video because she likes crime fiction. And when we get started, we'll let you hold these breast implants.
Thank you.
Okay? He's so professional. Look at him, my man. Okay, more to follow on Hair Fix Friday. So how'd that go? How did you think that first take of our Hair Fix Friday video?
I think that was fantastic, but given that you are a tight end, I'm going to have you go long. We're going to see if you can catch a breast implant.
That's great. I like that. How you doing?
I'm doing great. How are you?
No medicine, no nothing. We already did the harvest, and how'd that go?
It went beautifully.
The president of the Chicken Little Club, right here. Dr. Schaffner. So now we're getting ready to just fill some grafts in here on the top. We'll show you some pictures of that in a minute. But nobody's here to see me. They're here to see you. What do you have to say?
Well, there's a tiny little pinch in the back, and after the first one, it's pretty much numb at that point. Very little feeling at all. And now we're about to repeat the same thing here and see how we can go ahead and reverse some of the hair loss that's happened over the years.
We were just talking. It's not easy for anybody for a lot of people to come in and have a procedure done. I don't like it myself. I have to meditate. I have to be very calm if I have a dental procedure. Dr. Schaffner, the self-proclaimed president and doctor of the Chicken Little Club, not the easiest thing for him to do. So I'd like to hear in his words what he had to say about actually not thought about it for a long time.
No, there's no doubt. I've recognized that I've had hair loss. I used to have a very thick head of hair, dense, and over time not only became grayer but less dense and a more recessed hairline, all of which are of course signs of aging, and we've known each other for almost 20 years and wanted to explore the opportunity to get hair grafts and follicular unit extraction, FUE. But the reality is that like many doctors, we're very good at giving, but not so good at receiving. And so here today to receive and from one of the best hair transplant surgeons, so thank you.
Very good. I don't know about me, but that's well said. It's easier to give than to receive in this setting. So I'm glad you had to hear from the doctor himself. And we're going to move on into the next phase of the hair transplant.
He was very gentle. It really felt more like pressure. You feel the cold, you feel wet, but you do not feel the pain after the first prick. So it was really.
Would you call me?
Yeah, exactly. So really a great experience.
For Hair Fix Friday, everybody should know that I was going to kick his ass if he didn't do this.
Why? Because the fact I trust you. That's the real reason. Trust you 110%.
Thank you. Thank you. I don't know why.
Because I've seen many patients walk out of here that you've done and the results, and you do great work, plain and simple.
Thank you.
And you care, and you're honest.
There you go.
And you're a straight shooter.
Thank you.
And well, obviously, it's the way all doctors, including me, make a living. Not all doctors truly put their patients first, and you do.